My name's Dr. Joanne Watt. I'm a GP in Corby in Northamptonshire, and I've worked here for the last 18 years. We know that things have changed over the last few years, and particularly at the moment, things are really hard, and managing to match demand and capacity can be a real challenge, particularly with the same-day consultations for minor illness. There are lots of things that many of us would want and things that we would want to be different about the way we work. And part of the solution is the Pharmacy First scheme that's just been released. We know this isn't the answer to everything, but it's something that will help, it's clinically safe, and it's something that will take the pressure off practices. We have the 7 new consultations that our teams can signpost to pharmacies, as well as additional blood pressure checks and oral contraception as well. There's an additional guide that I've produced that I'm going to talk people through some slides. So if you want to show that to your reception and care navigator teams, it may just help people to understand what can be done with this scheme, how there are advantages, and there's lots more information on the NHS England website as well. If you need more information, please do contact your local teams, and we want to just try and help you as much as we can in a limited way. Get to know Pharmacy First, get to know your local pharmacies, see how you can work together to provide services that are of benefit to your patients and to your team as well. Thank you. This is a presentation for receptionists and care navigators, and it's really important that you feel confident using Pharmacy First, and hopefully by the end of this you will feel a little bit more happy using it. My name is Dr. Joanne Watt. I'm a GP in Northamptonshire, and I'm also Associate Medical Director for Primary Care and Primary Care Networks within the NHS England Midlands team. Pharmacy First is part of the pharmacy element of the Primary Care Access and Recovery Plan. This is a national initiative to support primary care and to make sure that actually where people can safely be seen within community pharmacies, they're able to be seen within those services. This service went live on the 31st of January, and we expect it to expand as time goes on. Many of you will have used the previous version of this, which was called the CPCS, so Community Pharmacy Consultation Service, and we appreciate that for some of you this will be the first time that you're hearing about these services. Pharmacies all over the country can offer this, including distance pharmacies. Although they won't be able to look in ears, they will be able to offer all of the other services using remote consultations. These are the 7 new clinical pathways that you can refer to under Pharmacy First. So uncomplicated urinary tract infection, shingles, impetigo, infected insect bites, sinusitis, sore throat, and sore ears. There is an age range that people are eligible for this service, so it's really important that we don't refer people who are outside the age range specified, or they will come back to the surgery because they're not eligible. The reason these age ranges have been chosen is that because safe care, according to protocol, can be offered for people in these age groups. This is one of the pieces of paper you may wish to either save to your desktop or laminate and put behind your screen so that you've got it there as a quick reminder. These are the minor illnesses that have been available at community pharmacies for some time under the CPCS service. Most of these can be sorted by using over-the-counter treatments, and obviously where there is a problem, people would be signposted back to their GP practice, but most of these pharmacists can deal with very nicely. This is a little bit more detail about the 7 clinical pathways, the people who are eligible and the people who are not eligible for the service. And if somebody is excluded, they will be asked to get advice from elsewhere. But where they're included, they may be offered prescription-only medicines if those are appropriate, but not in every case. We're often asked why it's important for practices to refer to Pharmacy First, and the main thing is that where people can be seen safely in their local community pharmacies, that improves capacity within the practice for the sorts of things that only your clinicians can sort. It will improve access, and actually many of these pharmacies are open far longer opening hours than many practices or primary care networks. We hope that eventually patients will go directly to community pharmacies for minor illness and medicines advice, but we do know that that's going to take a little time, And in the meantime, this is going to be a really good way to help people to understand what community pharmacy can offer. We're looking forward to improved relationships between practices and community pharmacies, and we really want to help patients to self-manage their health and to be able to make the right decisions about how to get care. We've also asked, can community pharmacists do this and do they want to do this? And actually they have been very, very enthusiastic. The majority of pharmacies have signed up for this service. We do know that the funding is different and community pharmacies are funded for each of these patients that they're seeing, unlike general practice that has a 1 year of funding, regardless of how many times a patient appears. And we do know that that is a very different way of funding the service. We know that in a few years' time, many community pharmacists will be independent prescribers and some are already independent prescribers. But in the meantime, this is a really useful service using the patient group directives to safely treat people from a limited number of conditions. We know that some community pharmacies are finding it really tough at the moment. And if you are near to a community pharmacy that seems to be struggling with their workload, please talk to your community pharmacy clinical lead. I'll give you their details later on. And if they're struggling, they should be able to get some help that allows them to support you with this important service. This is how you refer patients to pharmacy first, and we know that patient queries will come in through a number of different routes. We know many surgeries are doing total triage or partial triage, and the queries may come in through face-to-face, phone, online, or via one of your online consultation tools. If a patient is suitable, it doesn't matter how the query came in, you can still put them through to the Pharmacy First service, so you can refer them on to the community pharmacy. Clinical systems have slightly different ways of doing this, so make sure that you're familiar with how your clinical system works. And then the patient has a community pharmacy consultation, face-to-face, phone, or via video. There are a number of different ways of that patient being seen, and this is particularly useful when a patient may be away from home elsewhere within England. You refer patients to pharmacy first, you ask them where they would like the referral to be sent, but the good thing about doing the referral is if this is not available, they will do an onward referral to a pharmacy that does have availability. It's important to find phrases that seem natural and comfortable for you to say, and on this slide there are a few phrases that you might find useful in order to explain to patients what you're doing and why you're doing it. The main thing is that they get a same-day consultation and that the same medications are available as would be available for the majority of people were they seen within the surgery. You will be able to look up and see which of your local pharmacies you can refer to. And if you're having any difficulties with this, please speak to your local lead, either within your ICS, your community pharmacy lead, or to your local pharmaceutical committee, and they will both be able to help you. Once the patient has contacted the pharmacy, they will ask them appropriate questions, they will do an examination, and if necessary, they've now been trained to look in ears using an otoscope if that is the problem that the patient is presenting with. If the problem can be resolved by using something over the counter or some self-care advice, that will still happen. But if antibiotics or antivirals are required, those can now be issued under this scheme. If a patient doesn't pay for their prescriptions, they won't pay for their prescriptions using this service either. And I know that's something that's a worry for a lot of patients. We often just wonder, why can't patients just go to the pharmacy? And actually what's really important here is that they're not just signposted, but actually because their information goes through to that pharmacy, if the patient doesn't turn up, the pharmacist will contact them and rearrange an appointment if necessary. In time, the information will come back, hopefully directly into the notes, but this allows much better communication between the practices and the pharmacies if we do the referral. As time goes on, the digital elements will improve, there will be more information, and actually the community pharmacies will be able to see even more of the patient's clinical notes than they're able to see at the moment, and we will make sure that you're kept updated on this. So this is just a bit more information about more information coming through so that you can actually code that information, particularly for patients for things like tonsillitis. You'll want to know how many episodes a patient has had in order to make sure that they those are included within the GP record. Many people are really worried about bounce backs, but actually well over 90% of patients will get their care completed by the community pharmacist. And for those that are either not within the inclusion criteria or who may be a little bit sicker than originally expected, they may have an onward referral, but that may not necessarily be back to the practice. It might be to an urgent treatment centre, or it may be even to an A&E department. It doesn't mean the service has failed. This is how a safe service is offered, and it's important that where somebody doesn't fit the criteria of the skills that the community pharmacies have, that they can get their care elsewhere. It may be that you wish to have a conversation with your local pharmacies about how best to manage these patients, and this is very much up to you to determine locally. There's just a couple of other services that I wanted to mention. So there's a new service where many pharmacies, not all of them, but many pharmacies can both start and continue oral contraception. So that's anything in tablet form. And we know patients have found this an incredibly helpful service, particularly when they're away from home or they need to see a pharmacy on a Sunday where practices and PCNs may not be available. This is a service that a lot of patients really appreciate. There's also a blood pressure check service, both for people starting medication for blood pressure who know they have high blood pressure, but also for patients who don't know they have high blood pressure. The importance of managing high blood pressure is that we can actually prevent people from having heart attacks or strokes. And again, there are people who may find it difficult to have blood pressure checks in the normal way, who may not have a blood pressure check cuff at home, and this can be really helpful for a lot of patients. So there will be lots more information coming out. We're all going to learn more as we do this service. Please talk to your local community pharmacists, find out what works for you, find out what happens in your area, have a bit of a think within your team about what prompts and information you want to have handy, either digitally or on laminated sheets behind your desks. And for more information, please do contact your community pharmacy clinical lead, and hopefully this will make things better, both for you and also for the patients that you serve. Thank you.